I don't mean no fun by that. There's no fun in doing better, right? She was making good sense, right? And
Yeah, she
Yeah.
just keep it.
she would have also reached out to me in regards to the 40+ society and asked me to advise with consent to being one of the persons who would also consider the opportunity. And I said, I had to talk to my boss. So Shannon gave me time to finish talking to my boss. She did that and I did find some other people. And so Shannon, I want to say to you that my has given me consent
Awesome.
to be able to,
Great.
and so likewise, I'll be making the contribution,
Excellent.
assist one of them.
Thank you, thank you, thank you.
Dr. Dean walking in right on time, you get the last one. So you don't want to try and get the car. I like Jamal right on time.
Jamal, make sure the price is $10 for that.
$10, yeah, that price is not sure to me this hour. Oh, I'm seeing that BBL there.
Oh, my
That's trying to tell my consumer. Yeah.
Dr. Dean, it's my pleasure to present you this congratulations for coming on. This Polio Plus. Helping us and achieving really eradicating polio this season. Congratulations.
Okay. I'm going to invite our sergeant at arms, who is going to come now and introduce our speaker for this afternoon. President, Secretaries, gives me great pleasure to introduce Dr. Duke, now the Indian surgeon. He holds a degree in
And that's it. Yeah.
Right? Laparoscopic topic, urological surgery, the University of Transport. All of you are going to be fine. Thank you very much, Jamie. Dr. Pedro has worked in South Africa, Germany, and France as a board certified urologist and laparoscopic urological surgeon. Major. The member of the European Association of Urology. He finished his postgraduate fellowships in endourology, and urology. Okay, come on. All right, follow me. With renowned Germany Kidney Stone Authority and Tulium laser prostate pioneer. I see why the president gives us. Professor Andre, okay. Professor Andreas Rose and with Professor Sanjay Kalpani and surgical oncologist Shaylis Pun Tom Becker, both renowned in the field of urological surgery. Dr. Pinto
consults at Doctor Hospital and provides services to the Princess Margaret Hospital and Family Medicine Center. His office is Urology Care Bahamas, located at Oak Tree Medical Center #2, 5th Terrace on Mulgore Avenue. As we recognize November to showcase men internationally, please join with me in welcoming Dr. Pinker.
We just glad you finished them.
Thank you very much for having me. It's a pleasure to be here, particularly in company of my favorite uncle Larry, who has always been a tremendous inspiration and support for me throughout my life in every facet of my life. So thank you, Uncle Larry. All right, so it is Men's Month in terms of it being Movember, where we try to highlight a lot of issues that men notoriously, particularly in this country, tend to ignore. We want men to realize that they're not alone, that the issues that they deal with, are very common, and that men throughout the world face them as well. So it's important that men realize that there should be no shame and they should not be suffering needlessly with many common problems that inevitably all of us are going to face at some part of our life. So knowledge is key. If we were to highlight what is really going wrong with their body and we are able to recognize it, and we're cognizant of the fact that there are many ways that we can solve the problem, I think there are going to be a lot of men who are not going to be needlessly suffering with things that unfortunately are going to affect not only the quality of their life, but the longevity of their life. So there's so many issues. The first thing I'm going to obviously highlight as I get to the more important issue of erectile dysfunction is prostate. And so when we talk about prostate, we're going to talk about the more common problem, and that's benign prostate hyperplasia, which is going to afflict every man if he's going to live to middle age or older. It's an inevitable part of getting older. In fact, we look at it in terms of decades. About 50% of 50-year-olds, 60% of 60-year-olds, and probably even more than 70% of 70-year-olds are going to face either irritated or obstructed lower urinary tract symptoms. So they're going to have a weak urinary stream. It may take a little bit of hesitancy before the stream starts. So a lot of men don't realize they're in a public bathroom and are coming and going, and they're still waiting to finish. So right there and then, you know there's something wrong. Waking up many times in the night when
we can talk about the annuitant exercise.
urinary urgency, where they're no longer able to delay urination,
Okay.
where they have your
It didn't work?
schedule. Where's the next bathroom? You don't have to let the bathroom control your life or your bladder control your life. There are many ways that we can medically or minimally invasively give you back control of your bladder and your happiness. So men know themselves something is wrong. If they feel like they're not emptying their bladder, if they feel like men shouldn't be getting urinary tract infections. Definitely they shouldn't be getting them recurrently. So if they are experiencing burning, the sensation, if they're not having good flow, if they know that they're not emptying their bladder, if they're peeing more than every 4 hours, or if they're waking up more than twice in the night, then you need to seek help, and seek help is readily available. So as I mentioned, it's a very common problem that almost every man is going to face. Just a diagram there showing a normal prostate, and essentially an enlarged prostate is going to envelop and basically obstruct, like a barrier, the emptying of their bladder. So no matter what they do, they're not able to empty their bladder because that obstructed prostate. Another diagram showing normal on the far left, and then on the right you can see the obstruction of not only the outlet of the bladder, but the actual pee pipe, the urethra itself. So there are many medications that we can prescribe. Many men, middle-aged, really would know the name tonsillosin and Flomax. That's usually worldwide what the most commonly prescribed medication for benign prostate hyperplasia. Unfortunately, there are side effects related to that medication, as there are with any medication where you can have lightheadedness. That's why we always ask the patient to take it just before they go to bed. You can also have an issue with retrograde ejaculation, which a lot of men are not going to be very happy with, where they're going to have the sensation that they orgasm, but the ejaculate and a lot of the fluid is going to go back harmlessly into the bladder. And after the sexual episode, they're going to urinate it out harmlessly. There are other medications that also unfortunately can affect their erectile prowess. A lot of men do not like to take that. Some of them can cause headache, flushing of the face, GI upset. Everybody's different. Some men tolerate it very well. Some men it's not tolerated at all. But the take-home message is even if the medication works, it's not going to stop your prostate to continue to increase in size as you get older. So almost inevitably, even a medication will work for 5 years, 10 years, 15 years. There's going to reach a point, it's not going to be an abrupt point, but gradually it's going to show that the medication is going to become less and less effective as your prostate gets enlarged. It'll reach a point where the medication is basically ineffective. And at that point, we go to the next stage where we can offer more than half a dozen minimally invasive procedures. And I mean by when I speak about minimally invasive, we're talking about outpatient, single cut, stitch, no recovery. We can even do it on a long lunch hour. You can go right back to work without any pain. And essentially, we can reduce the size of your prostate to the size of a 20-year-old. So you're urinating like 20 minutes. So you don't have to be waking up all through the night to urinate. You don't have to know where the next bathroom is. You can enjoy a glass of wine. You don't have to stop drinking water or any liquids at 6 o'clock or 7 o'clock if you want to get a good night's sleep. Or you're even afraid to have a cup of coffee in the morning or a glass of wine with friends. So you can get back into life either with medication in at the first line of treatment. The next line of treatment is minimally invasive procedures, which are readily available here in the Bahamas. Again, looking at the restriction caused by the prostate there on the diagram, you can see as the prostate grows, it can completely envelop and basically obstruct the outlet of your bladder and your urethra. So this is one of the minimally invasive options. We can use an energy source to reduce the size of the prostate and basically remove all the obstructing prostate that's preventing you from emptying your bladder. So going further, always listen to your body, never have fear. The cornerstone of any physician's practice is confidentiality. I've heard it all. It's not going to change the expression on my face. I'm gonna, if I see you outside of the office environment, I won't even acknowledge I know you. If you want to acknowledge, I'll say good afternoon or good evening. But everything that is told to me in confidence stays in confidence. And trust me, everything that you tell me, I've heard probably a dozen times before I saw you, and another 20 times after I saw you. So you're not alone in anything you suffer with. So the big thing that's facing this country, and it's a pandemic in itself, and that's prostate cancer. As many as 1 in 5 men, 1 in 6 men are going to get afflicted with prostate cancer in their lifetime. It's the most common prostate cancer is the most common cancer in the country, and it's not even close. If you grow to 80 years old, almost every man is going to have some element of prostate cancer. It's not going to necessarily be the cause of your death, but if we were going to test every 80-year-old for prostate cancer, probably 80% are going to have some amount of prostate cancer, even if it's clinically insignificant. That's why most places in the world, we stop even checking for prostate cancer when you're 75 or older, because we're going to find everybody has prostate cancer. And in many cases, it's going to be clinically insignificant. The good news about prostate cancer is 5-year survival for early disease is 100%. 10 years is 98%. So it's one of the easiest cancers that we can cure. So the basics for cure is early detection. How do we detect prostate cancer? We get an annual prostate-specific antigen blood test every year from the age of 40 until at least the age of 70, and many men will even go to the age of 75. You don't want to miss a year or 2 years or 3 years, because in that intervening time, that's the time you can develop prostate cancer. We have all the risk factors for developing not only prostate cancer, but a more aggressive form of prostate cancer, in that we are predominantly of African ancestry. we're living longer, and we have a high rate of obesity. So obesity doesn't cause prostate cancer, but it can cause a more aggressive form of prostate cancer. In your middle age, if you're consuming a large volume of alcohol as well, that can increase your risk to develop a more aggressive form of prostate cancer. So because of that, we have all the risk factors. We want to make sure that we're very diligent in picking up prostate cancer early and making sure that we have an excellent cure. It's a crying shame that we have at least 100 men every year dying of prostate cancer, and it's not a very pleasant death, and it's not an immediate death either, when they could have very easily had another 20 years where they could have enjoyed their golden retirement years with their family, their wife. They could have seen their kids and their grandkids graduate from college, et cetera, et cetera. So for prostate cancer, we can pick it up early. In fact, we have so many ways of picking it up so early is that we have a modality called active surveillance, where we can pick up prostate cancer so early when it's so low volume, so clinically insignificant that we can watch you for many years, maybe 8, 10, 12 years before we need to cure you. Curing prostate cancer doesn't even necessarily need surgery. If we offer surgery, it can be done minimally invasive, where little keyhole incisions where we can, let's say you can be up and out of hospital the next day. We can offer you brachytherapy, which is an outpatient 40-minute procedure where we place strategically low-dose radioactive seeds that kills only the prostate cancer cells, leaves the rest of the gland intact. We can offer radiation, external beam radiation as well, which is a outpatient painless procedure. All of them have excellent cure rates. Obviously, every patient is different, every disease is different. So we have to make sure that every patient is looked at as an individual and determine what is the best treatment modality for you. We can offer HIFU, which is high intensity focused ultrasound, will basically keep the prostate cancer and destroy it. We can offer cryotherapy, where we can freeze the prostate cancer and destroy it as well. So there are many different ways that offer an excellent cure. And as I mentioned, you can have a 100% cure rate if you can pick up prostate cancer earlier. So to address the elephant in the room, and I'll refer to the American Urology Association and the European Association of Urology. So every specialty in medicine has a governing body that dictates what is the gold standard in terms of either screening, in terms of treatment, in terms of management. And in terms of prostate cancer screening, both governing bodies will specifically say that the digital rectal exam has no role and has no benefit in just routine prostate screening. So there are thousands of men in this country in particular who, if they never went for prostate cancer screening, an embarrassing episode of the digital rectal exam, and they'll never go again. And we've really done a disservice for them, because what we're doing in first line screening is we're just trying to pick up early disease. And in many cases, we're just trying to get a baseline PSA blood test so that we can follow you for 1 year to the next. So you can have prostate cancer and have a normal PSA specific antigen blood test result. But if there's a big jump from 1 year to the next, that might be an indication of there being an element of prostate cancer. So 15% of men who have prostate cancer actually have a normal PSA. What we're trying to do is pick up prostate cancer so early that even on the digital rectal exam, the prostate gland itself feels completely normal. So many patients will come to me and say, all right, my general practitioner did dreaded digital rectal, and they said, all right, despite my PSA jumping from 1 year to the next, or the fact that my PSA is elevated, he felt my prostate and said it felt normal, so I'm fine. And that patient will keep that with them for years while their PSA continues to rise. When we pick up prostate cancer early, we want the prostate to feel completely normal. So feeling a normal prostate on digital rectal that's normal doesn't mean that you don't have prostate cancer. So why are we doing that as a screening? So we're going to do a PSA blood test. We have more specific blood tests. We have a urine RNA test that can pick up prostate cancer even quite possibly 5 years before prostate cancer becomes clinically significant. We have imaging that's very highly specific and sensitive, where we can pick up prostate cancer, again, where we can watch you because the lesion is so small, and we can do targeted biopsies to make sure we get an accurate diagnosis. Although we can do an MRI of your prostate, multi-parametric MRI of your prostate, or we can do a PSA, that CT scan that can pick up prostate cancer very early. So digital rectal exam really has no value in routine screening. I'm not gonna say it doesn't have a role in terms of follow-up or in terms of staging, but it's in terms of, I'm a 40-year-old, 45-year-old, 55-year-old, I've been going for my annual screening, routine blood tests. There's no need to subject someone to the digital rectal exam. All that we're gonna do is cause many men to speak amongst themselves in the bars and in the churches and in the neighborhoods and say we're never gonna get it. And all that's gonna do is cause a lot of men to die unnecessarily of prostate cancer. And if you're gonna wait for symptoms, prostate cancer has no symptoms when it's early. That's a big misconception. When you have early prostate cancer, it in fact has little to no symptoms. So symptoms, you're gonna wait until it's too late. So if you have urinary symptoms where you're not emptying your bladder, statistically speaking, you have benign disease. So don't let that make you fearful to come and seek the consult of the urologist. The next, obviously, big issue is erectile dysfunction that affects men and women and couples throughout the world. And I can say confidently that every man is going to face erectile dysfunction at some point in their life. And it's not anything to be embarrassed about. So erectile dysfunction, we look at the root cause. There's no point blindly give you the blue pill or the Cialis or the Levitra, because all we're doing is treating the symptom and not the cause. In medicine, we want to treat the root cause, or even if we give you medications to get your the cause is going to overwhelm and cause irreversible damage and cause damage to other organs. So we look at erectile function as basically a glimpse of your general health. It can determine whether you may have onset of possible early cardiovascular disease, because if you look at it this way, before you get any obstruction of the large coronary artery vessels that supply your heart, you're going to get obstruction of your smaller blood vessels, and those are the blood vessels that supply your penis, your male members. So if you're having what we call vasculogenic erectile dysfunction, where your erections are not as good as they used to be because of a poor blood flow, that might be a sign that you have early cardiovascular disease. That might be a sign that you have onset of diabetes or uncontrolled diabetes, even if you know you have diabetes, or high cholesterol or atherosclerosis. That can, if you seek the consult of a physician, that if you can address that root cause, can prevent you from getting a heart attack 15 years down the road or a stroke 8 years down the road. Again, if you're going to get a stroke, the vertebral arteries that supply your brain are going to be obstructed way down the road, long before you get obstruction of your small blood vessels that supply your penis. So we always treat the root cause. Don't borrow a Viagra from your friend. Yes, that might help you for 2 years, but if you have other things going on, that Viagra is going to stop working, and it's not that you become accustomed to it. It's the fact that the root cause is overwhelming you and causing damage to your kidneys, to your heart, to your eyes, to your blood vessels. So listen to your body. If your erection is not working, it might even be low testosterone. So every man from the age of 40 is going to have a fall in the testosterone at least 1 to 2% per year. Some men start at a lower value than others. And in this country, we have a high rate of obstructive sleep apnea. A lot of men don't even know what obstructive sleep apnea is. Their partners will know that they're snoring and that they stop breathing and they seem like they're choking on their breath. Obstructive sleep apnea can make you feel fatigued. It can make you feel a shell of your former self. You're going to basically put you in the male version of menopause. You're going to put on weight, particularly in your midsection. You're going to have low sexual drive. You're going to have low energy. You're going to be prone to depression, heat intolerance, hot flashes. You're going to be basically old before your time. And there's no need for that. You're going to feel fatigued because you're not getting that proper deep sleep. REM sleep, rapid eye movement sleep. So there's non-REM sleep and there's REM sleep. REM sleep is the deep sleep where you're dreaming, where you're getting that deep sleep where you're replenishing all the energy that you need. And that's also the time you're replenishing the testosterone that you use throughout the day. So you may sleep 10 hours and have almost all of that being non-REM sleep, and you're going to feel almost more tired when you wake up than when you went back to bed, when you first went to bed. So it's not the number of hours, although we try to aim to get 7 hours of good sleep just for your heart and your general health, but you need to make sure you're getting that proper REM sleep. If you say you don't know the last time you dreamt, or every time you wake up and pray you wish you had another 2 hours, or you fall asleep all the time. The TV is always watching you, or you always have to take a nap at the end of the day, or you're always feeling fatigued, or even to the end of the spectrum where you're falling asleep at a stoplight when you're driving, which is obviously going to be hazardous to you, your passengers, and to the community as a whole. You know something is going wrong. If you have to drink caffeine, coffee, tea all day just to get by, and you're at that age group where you're going to have an enlarged prostate anyway, all you're going to do is cause yourself to want to have to urinate every 15 minutes, and that's not solving the problem. So there are too many men in this country who have put on 40 pounds unnecessarily. They don't have good erections. They're causing them to have low self-esteem because of their body habits. They're feeling low confidence as well. It's affecting their marriage, their life. They're feeling like a zombie because they're tired all the time. It affects them socially, professionally. Sleep apnea is something that easily can be treated, and we don't necessarily need to do any very exhaustive investigations. There are monitors that you can take home and hook up very easily, and it can analyze your own sleep and your comfort of your own bed. You bring it back to the medical facility. We'll take the chip. They'll analyze whether you had sleep apnea. Is it mild, moderate, severe? How many times are you having hypoxic episodes where you stop breathing for a few seconds? And for many men, they'll be astonished and they stop breathing 6 times in 5 minutes. So obviously, when you think about sleep apnea, you would think about the dreaded CPAP machine, where you have this cumbersome machine, you're wearing this mask, and it's not very convenient. Obviously, it's not very comfortable, but there are many things that are actually advanced in terms of sleep apnea treatment, including having a medical device created by your dentist, where it's an implant where basically it moves your jaw forward. It's like a implant where kids who have a retainer. So it's a mold of your own mouth. It's very comfortable. It brings your jaw forward so that the tongue doesn't fall back. So it doesn't cause a sleep apnea. And that can make you feel like a new man, make you feel refreshed for the first time. That's going to make sure your testosterone is not going to drop every night. It's going to make sure that you have that proper REM sleep. So you're going to feel like a new person. You're going to you're going to lose 70 pounds. Many studies, there was a landmark German study that showed the average man who has obstructive sleep apnea, if we can treat the sleep apnea, we can correct the testosterone, they can lose as many as 70 pounds, which is life-changing. If you're carrying around an extra 70 pounds, you're going to be at risk of heart disease, you're going to be at risk of hypercholesterolemia, high cholesterol, you're going to be at risk of developing diabetes, hypertension, and it's going to cause a whole cast of events that are going to reduce not only your longevity, but the quality of life. So sleep apnea is something you may not know, although you're going to feel tired all the time. Your wife or your partner is going to know that you're basically stuck breathing and you're choking on your own breath. So if you know someone, let them seek help, because that can change their life in so many ways. Another thing that I'd like to address is vasectomies. Men cringe when they hear that, although a lot of men, particularly because of the society of sweethearting, they will be happy to know that no, their sweetheart can't get pregnant. So obviously, vasectomy doesn't prevent against venereal disease or HIV, but it's very expensive. We have one of the highest rates of inflation and highest cost of living in the world. If you want to give the children that you have the best, and you're working hard to do that, obviously you want to have peace of mind that you're not going to have that unwanted child. And I use that word unwanted loosely. Every child is a gift from God, but if you have 4 kids and that's all you wanted, why stress yourself by having 2 extra kids, which is going to affect what you're going to be able to provide for the kids that you have? A vasectomy is a painless outpatient procedure. We don't even use a scalpel or a blade. It's a puncture technique. It takes literally 15 to 16 minutes. It could be done on a lunch hour. There's no recovery. There's no pain. And that's the only 100% effective way of birth control. Tubal ligation is not perfect. Birth control pills notoriously going to cause women to put on unwanted weight on. They're going to cause them to have mood instability, emotional lability. So if you can get your partner off the birth control pills, if we can get you a vasectomy, which will not affect your erections, your sexual libido, you're still going to ejaculate. If you look under a microscope, you can see the sperm in the ejaculate. in any way, it's not gonna affect you. In fact, you probably have better erections because you don't have in the back of your mind, oh my God, am I gonna get this person pregnant? So let's put the lead back in your pencil in many ways and ones. In terms of erectile dysfunction, let's treat the root cause. It should not be something that you need to suffer with needlessly. The most common form of erectile dysfunction is actually premature ejaculation. A lot of men don't realize that 1 in 3 men have premature ejaculation, where 2 minutes, 3 minutes, they're done. And unfortunately, as they reach middle age, the refractory period to rebound might be 12 hours. And then they wait that 12 hours, and then they got another 2 minutes, and nothing is really happening. So that's the question for everybody. And if 1 in 3 men are suffering from this, and many of them suffer their whole life with this, we can effectively give you medication that can give you within 10 days or 2 weeks of taking the medication. 2 minutes to 15, 18 minutes, and that's life-changing. So stop suffering any form of erectile dysfunction, including premature ejaculation. Stop suffering with any form of urinary issue where there are men, whether they're taxi drivers or police officers, who have to drive around with a cup because they can't even get enough time to pull over the side of the road to urinate. So that is affecting that's your own self-esteem is going to be affected by that. You're letting your body control. You're always perceiving yourself as smelling like urine. You don't have to live like that. So low testosterone is something that we're always going to address if you have erectile dysfunction, because low testosterone is something that affects a very high number of middle-aged men. As many as 1 in 8 and 1 in 12 men are going to have be symptomatic of low testosterone, where they're going to put on weight, they're going to have low sex drive, they're going to be irritable, miserable. And you can look right there, low libido, loss of muscle mass. They literally don't have to shave as often as they used to. They're losing the hair on their arms and their legs. It also can affect the density of their bone, where they're going to put them at risk of osteoporosis, where you have increased risk of fractures. So in an aging male, if we need to give you testosterone, we'll do so. Obviously, we want to do so safely. We don't just blindly give you testosterone if you have low testosterone, because firstly, if you have early prostate cancer, giving you testosterone is going to cause that prostate cancer to rapidly proliferate and progress. You're going to make early prostate cancer, advanced prostate cancer. So the first thing before we give anyone testosterone is why you have low testosterone. If it's sleep apnea, if it's age-related, there's a primary cause, there's a secondary cause, there's some other very rare causes. So obviously we want to determine what kind of what we call hypogonadism, low testosterone that you have, treat the root cause, and then safely give you testosterone and get your life back on track. And as I said, you can lose as many as 70 pounds if you have low testosterone. But we're not going to just give you low testosterone blindly. We need to, and in medicine and urology, we have to treat the root cause. In fact, just giving you testosterone, you have sleep apnea, can actually make the sleep apnea worse. So male circumcision, that's another thing. And next to vasectomies, it causes men to cringe. It's never too late to get a circumcision. And many men know that even sexual activity is excruciatingly painful because of their tight foreskin, causing micro tears and infections because the foreskin is just so tight. You cannot retract the foreskin to clean underneath the glans penis. That is going to cause you to have recurrent urinary tract infections. That's going to put you at risk of developing sexually transmitted disease, including HIV. So obviously, I'm not going to advocate use of condoms, but studies have shown conclusively that if you do have a circumcision, it can reduce your chance of getting sexually transmitted disease, including chlamydia, syphilis, gonorrhea, herpes, and HIV by as much as 60%. So the inner foreskin of the penis actually is almost like a rapid conduit for these viruses. So if you can remove the foreskin, it significantly reduces your chance of getting all the sexually transmitted diseases, including HIV. So that's a benefit of getting a circumcision, which can be done in 20 minutes painlessly. You put dissolvable sutures, you go about your business like nothing happened. We give you a regional block that that day you don't even have any pain, you might want to take an Advil or Tylenol for a few days, but it's not a gruesome event, and you're not going to be limping around or in a wheelchair. You're right back to work. In fact, I do it many times on a man's lunch hour, and I go right back to work like nothing happened. And there are many benefits to it. So if you're suffering because you can't retract your foreskin, or because you're out there, you don't like to use a condom, which unfortunately too many billion men like to do, getting a circumcision is not going to prevent HIV, but it can significantly reduce your chance of getting it. So as I mentioned, I'm just putting a statistic there, and that's US statistics. It can cost up to $250,000 to raise a child up to age of 18. So vasectomy can save you $250,000. Yeah. So it is a much better option if you value your sleep when you might and have children that you want. Next, another thing that a lot of men suffer with is they feel like, you know, this is a word that I hear all the time in the society. As I get older, Doc, I'm getting long balls. My balls are going down to my knees. So it's not that your testicles are enlarging in size, it's that every testicle has a protective lining called a tunica vaginalis, and it's bathed by a fluid. As we get older, the ability for the inner lining to reabsorb that fluid is sometimes inhibited. So you're going to have the same amount of fluid produced, but less of it reabsorbed. So the cumulative effect is you're going to have more fluid around your testicles. So it's going to feel like your testicle is enlarging and it's falling down, and it can make you feel uncomfortable, and it can look unsightly, and literally you can't even cross your legs, and every time you walk, it's very uncomfortable. A hydrocele is something that's very common, and that it's something that we can minimally invasively, all of our men of urology these days is basically minimally invasive. Everything is basically outpatient. A hydrocele can have your testicle, your scrotum, almost like a grapefruit. That's the extreme. But if you have something swollen down there, or if you're having pain down there, always seek the consult of your urologist. Testicular cancer is exceedingly rare in this society because in men who are of African ancestry, it's a rarity, but even then it can occur. Pain in the testicles is not an early sign of testicular cancer. It's usually a sign of an infection or referred pain from another reason, but never just sit on the problem and let it progress and stew and worry about it. Seek confidential and comprehensive and passionate care. All right, thank you for your attention. Any questions?
Great presentation by the female, like. So the men's association of the Roman Club of Nassau is asking to ask. How long should a man?
So that's everybody's personal preference, and obviously it relates to their partner as well. But if a man is not satisfied and the woman is not satisfied, then there's a problem. So on average, we're talking about worldwide statistic that's 5 to 8 minutes. Obviously, for some men, they want longer. So there are ways of dealing with premature ejaculation, including using thick condoms, etc. But that can cause desensitization, and you're in a relationship, all of a sudden you come home and you say, I need to use a condom. Obviously, that's going to cause a lot of questions and a lot of stress. So you don't want to do that. There are numbing agents as well, but if you use too much, you're not going to feel anything, and if it transfers to your partner, she's not going to feel anything. So the most effective way is actually to place a patient on SSRI, which is a selective serotonin reuptake inhibitor, which is an antidepressant. And the reason for that is not because they're depressed, although it's a depressing problem, it's because it has a wanted side effect of delaying ejaculation. So you can go from 2 minutes to 15 minutes. And the side effect is that you'll be in a better mood and less irritable.
Women's Association.
Doc, you know, just a comment. We've all been hearing about women problem.
But you really being deep in man today. You put us on the slaughter table today. You know, because we always have a women issue.
Yes,
And we as men, you know, we pretend we don't have no issue. You know, we macho, we ain't supposed to be having no issue like what you talk about, you know?
correct.
So I don't know if that's part of the problem, part of our problem.
It's a big problem.
Because, you know,
Ignorance as well, and fear. Yes,
Well, thank you very much for the presentation. I remember when you did my hernia surgery.
yeah.
Okay.
You did my hernia surgery. And I remember you told me I could go back to work the next week, right? And I was able to go back to my office the next week. It was a little uncomfortable, not unbearable, but I was able to go back. And it just shows you the advancement and the level of technology that you have. You mentioned sleep apnea, and a few years back, I was waking up in the middle of the night, couldn't breathe, wondering what was happening. And so I had a client and I went to see them and they started talking, they were a doctor, and they started talking about it. So I decided to go get the test. And when she did the test, she found out that I was not breathing like every 5 minutes. I was stopping just,
yes,
and like I said, just because of the information that I received and the fact that I had a client that I was able to go to, it actually saved my life. Because I'm sure by now, because I was having the same kind of symptoms, really moody, completely, really irritable. I probably still have a little bit of that, but not as extreme. But it literally saved my life, because if I hadn't gone there, I'm sure by now I would have already been dead, because it literally was stopped breathing for such a long period of time that it was actually shutting off everything. So I was very fortunate to hear the information. So you know, the information and the knowledge that you imparted is really important for us men and ladies alike to take issue with, because the information can really save your life.
yes, so, yes, correct. Sleep apnea is a silent pandemic in this country. A lot of men have a bare belly, and it has nothing to do with bear. It's related to sleep apnea, low testosterone, and yes, sleep apnea has a high association, correlation with cardiovascular disease. So you can increase exponentially your risk of getting a heart attack or stroke. It's gonna reduce your longevity in life at least by 10, 12 years if you got sleep apnea, and it's gonna reduce the quality of your life considerably.
So, Peter, this is one from the floor, then come to you. One from the floor, sorry,
From online?
Online, from Rotarian Shabar. Are there any foods men can eat to naturally deal with prostate issues? I heard that blueberries are good.
There's always a placebo effect. You're gonna have an enlargement of prostate related to your age, no matter what you eat or don't eat or exercise. Obviously, I'm gonna be an advocate of preventative medicine. You wanna have a normal body habitus, you wanna exercise 3 more times a week. Do it in groups so that you can be encouraged to stick with it, do something that you love. If you don't like the gym, don't go to the gym. If you like volleyball, play volleyball. Like swimming, go swim. Obviously, you don't want to have too much in the way of red meat and salt. You want to make sure you have a well-balanced diet. And obviously you don't want to eat to excess. So you want to reduce your fast food intake, et cetera, et cetera. So we all know what healthy living is. It's just going to make us better off if we have a normal body habitus, a normal diet and exercise. So even if we do get cancer, if we're fit, we're not obese, we don't have comorbidities like uncontrolled hypertension, diabetes, our chance of survival is that much greater. And obviously that reduces our chance of getting cardiovascular diseases as well. So I also need to mention that if you do have low testosterone, that can put you at risk of something called metabolic syndrome, where if you don't have diabetes, hypertension, or high cholesterol, it puts you at risk of developing that later in life. And if you do, it's more difficult to control. So low testosterone can have a horrible negative impact on your life.
Okay, I know we are far outside the time. You know, you want to
Sorry.
talk about, or you?
Just, the second is irreversible.
They are, yes.
So.
How easy is it to be reversed?
So within the first 5 years, it's quite easy. Beyond that, it's a little bit more difficult.
Let me trust in that.
Information you part of the work with us today is very important. very significant to the health and welfare of men. You know, you on the radio, your various talks, presentations and the like here today, you've been able to make this a very important and sensitive topic, provide a lot of humor with it. At the same time, convey how necessary and how easy it is to avoid that. And thank you so much for spreading the information and knowledge with us today, being here, spending your time with us. And you know, we hope that we take advantage, those of you who need to, all of us men, take advantage, will take advantage of it. And when you come to your surgery, your whatever you call it, your chamber, your office, and you have a discount there as well. That's another token of our appreciation.
Do we need to get a photo?
Give you this.
Appreciate it.
Right?
Thank you.
All right, thank you, everyone. Now,
Thank you.
Well, the earthquake was Jamaica, so the first thing we can share with you. Okay. Let's come to the raffles and fines.
And I'll give it to.
I'm giving you, we're gonna cover it now. Raffles and fines.
You know, honey. Hold on. You didn't even hear it. What?
Okay.
You didn't even hear it.
Give the answer to the ones. Okay, what fine we have? Talking on them. Right. You get it exactly how. Huh?
Ladies and gentlemen, this is gonna be very, very quick and as Dr. said, very, very painless. I was counting the men up here, 1, 2, 3, 4 men. They say 1 and 3. Anyway, last night we had a meeting and I'm so happy that we have a full house in-house and also online. We have a goal that we wanted to give $700 towards, I think it's the foundation. Am I correct?
Yes, polio plus.
For polio plus. So far, we've been able to collect $255.
Committee
And everyone had lunch today. They were supposed to be but giving up your lunch today, so I'm glad that everybody got their lunch. So we want to make sure that beginning with Gabrielle and going over, we want to hit our $700 mark today. So I'm gonna online. Yes. The first one donated online. So if you have donated online, just let us know the amount, because we want to be able to hit that amount today. We have 24 persons today, we're down to 15 persons online. I'm gonna start, I have my $50, so I made sure I didn't have my lunch, I'm gonna put in my $50 for my lunch today. So I'm gonna put that in, and if anyone else would like to get two online, $200 online, so we already have with the $400, $500. So we only need another $200, so if you're in here today, and that's for $25. Between each one of us, I want to make sure when Valentino goes back, he's going to say that the Rotary Club of Nassau came true. As the not only the first club, but the club that also is going to get the Holy Plus. So if you're here and Wayne, who wants to come and knock out that last $200? You know, anyone else? Put 200, man. I already put the 15. He wants to put his money, 180. All right, we're almost there. We only need 180 now.
I have $350 online now.
$350. So guess what? We have achieved. So I want to find this. Last time.
Oh, not another
50. Listen that. We have exceeded just in the fact that this, what you talk about now, so let's say that they I'm happy now to say that we had a meeting last night with the board. And let me tell you, this board is committed to helping RCN grow. And again, I want to thank you all for your contribution. This is what Rotary is all about. Thank you very much.
Thank you, thank you, thank you.
Okay, thank you all very much. Excellent work.
Thank you, thank you, thank you.
Great job.
Awesome.
Okay.
What we wrap it? Oh, you have it? You gave it to them?
I think about.
Where the wrap the prize? You gave it to them? Oh, Darren, I got it.
Okay. So the winning number is 61. Oh, beautiful. This is a lunch raffle here at the National Yacht Club, valued at $20. So who got 61?
61?
61.
Oh, not me. 67.
61. All right. Okay, I will kind of stand. Please. I'm going to come again for the full recess.
Before we test, ladies and gentlemen.
Then we're going to defer to.
Oh, okay. All right, let's do the 4-week test. On the things we think and say and do. Isn't it true? If we want to all the time, we're going to and friendships. We're going to all concern. Like.
Rotary around the world. Good day, everyone. Enjoy the rest of your day.